Hello everyone, we are back to our consideration of the middle cranial fossa to the superior surface of the petrous part of the temporal bone. And we have already said that anteriorly over here, close to the tip, you have the lodgement of the trigeminal ganglion covered in Meckel's cave like this. And we have said that from the trigeminal ganglion you have the emergence of the ophthalmic nerve, the maxillary nerve and the mandibular nerve, the three divisions of the trigeminal nerve. Ophthalmic division going into the superior orbital fissure, maxillary division going into the foramen rotundum, mandibular division going into the foramen ovale. And we have said that further behind you have the arcuate eminence formed by the bulging of the superior semicircular canal, and the rest of the bone right up to the margin at the junction between the squamous and the petrous part. This is called the tegmen tympani, or the roof of the middle ear and internal ear cavity. So the roof of the middle ear cavity is the tegmen tympani. So because somewhere here you have the internal auditory meatus and somewhere outside you have the external auditory meatus, we would presume that this region over here would contain the middle ear and this region over here would contain the internal ear. So this tegmen tympani then will form a roof of the middle ear extending right from the mastoid air cells and the mastoid antrum behind to the middle ear cavity to the roof of the auditory tube. So the entire middle ear cavity is roofed by this plate of bone which is called the tegmen tympani. Now this tegmen tympani does not stop at the junction with the squamous part over here, but it goes down as a fold. It goes down as a fold, and it goes down as a fold into the squamotympanic fissure, that is between the squamous part and the tympanic part of the temporal bone. And as you recall from your study of the temporal bone, the downturned part of the tegmen tympani which goes into the squamotympanic fissure differentiates into a petrotympanic and a petrosquamous fissures. However, that is not the topic of discussion here. What we are interested in is that over this tegmen tympani and close to the lateral margin, somewhere here, you have two other structures. Round about this part, you have two small grooves passing anteriorly, and these grooves are meant for two important nerves. The lateral one, the lateral groove carries the lesser superficial petrosal nerve, and the medial one carries the greater superficial petrosal nerve. Now the lesser superficial petrosal nerve is actually a part of the glossopharyngeal nerve, and the greater superficial petrosal nerve is actually a part of the facial nerve. So these two are meant for two different structures but have similar secretomotor functions. Now the lesser superficial petrosal nerve is the lateral one. It passes through the foramen rotundum along with the mandibular nerve. This greater superficial petrosal nerve is the nerve which will pass through the cartilage of the foramen lacerum. And as we had said that from the carotid opening you have the emergence of the internal carotid artery like this. And we have also said that on the walls of the internal carotid artery you have a nerve network of the sympathetic. So the walls of the internal carotid artery have a filigreed network of small nerves. These nerves are sympathetic nerves. Now from these sympathetic nerves, one filament joins this greater superficial petrosal nerve, and this greater superficial petrosal nerve along with these sympathetic filaments from the internal carotid artery becomes the nerve of the pterygoid canal, and this partially pierces the cartilage of the foramen lacerum and descends just below this junction to enter the pterygoid canal. So these are the important structures on the anterior surface of the petrous part of the temporal bone. You must however keep in mind that all of these are covered by the dura mater. Just as this dura mater forms the folds of the tentorium cerebelli, if we draw the tentorium cerebelli again now, you see, you will understand that this is the fixed margin of the tentorium cerebelli, and this is the free margin of the tentorium cerebelli, and the fixed margin is going here, and the free margin is jumping over, and therefore this internal carotid artery and the nerve network and everything else, in fact the entire cavernous sinus, is covered by this dural fold. So this triangular dural fold here in front of the crossing of the fixed and free margins of the tentorium cerebelli, this is actually forming the roof of the cavernous sinus over here, and in dissection you have to cut up and remove this segment of dura mater to see the internal carotid artery underneath and the blackish venous blood of the cavernous sinus. And even these two structures that you can see over here, they are also covered by dura mater. It is not that they are exposed and you can just see them, they are also totally covered by dura mater. And only when you strip open the dura mater, you can see that there are these fine nerves going through, the greater superficial petrosal nerve and the lesser superficial petrosal nerve. They are not visible through the dura mater. You have to strip the dura mater from the bone, peel it off, and only then you can see the greater and lesser superficial petrosal nerves. Now from this discussion we are now going to proceed into the posterior cranial fossa. Thank you.